A report today from a unique group of Canadian citizens asking Ottawa to fill a distinctly Canadian policy gap. Of the world's developed countries with universal health care, only Canada has no universal prescription drug program. CBC's Vicadopia has the story.
The sticky part on.
Emily Dukeshire thought when the hospital prescribed her medication after her pregnancy, she'd be covered by the healthcare system, but she wasn't.
Lots of Canadians just think that we're all covered and we don't have to worry about our drugs, but there's lots of us that fall through the cracks.
That's why when a federal research institute put out the call for a panel of ordinary citizens to examine Canada's extraordinarily pricey drugs and insurance costs, she volunteered. They found Canada's patchwork of public and private drug plans is leaving many Canadians in the cold. Today, their call to action to MPs.
The panel also calls on the government to move immediately to implement public coverage for a short list of basic, frequently prescribed drugs. This short list would begin the shift towards a comprehensive universal Pharmacare system.
The Trudeau Liberals didn't campaign on Pharmacare, that was the NDP, but this Liberal-led health committee has put it on top of the agenda.
Because it seems to be a hole in our healthcare system. Many Canadians don't fulfill their prescriptions because they can't afford them.
Pharmacare is the unfinished business of Medicare. It was part of the original blueprint for universal health coverage more than 50 years ago. Since then, political promises of action have come, gone, and gathered dust. This health policy expert says Pharmacare will cost billions, but other countries have also saved billions by negotiating lower prices with drug companies. But negotiations mean sacrifices.
So the quid pro quo is that for some expensive drugs that don't necessarily have big benefit, or even cheaper drugs that have no benefit, governments have to be able to say no.
And that's where proponents of Pharmacare say private insurance could come in, paying for drugs that aren't covered. Other countries follow a similar model, but this government has already said, given other healthcare priorities such as home care, a national Pharmacare plan would be years away. Vicadopia, CBC News, Ottawa.